My name is Erefaa Ogbuaku Jnr. and I am surviving cancer. I am a wife to my amazing husband of 21 years. I am a mother to our 3 beautiful children. I am also an entrepreneur and I'm a registered psychotherapist in Ontario, Canada. This is my cancer journey. 2022 was a beautiful year. At least so I thought. I had completed my master's in counseling psychology the previous year, and I was completing my clinical hours in order to be registered as a psychotherapist in Ontario. Sometime in March, I felt a pain on my left hip. I didn't think much of it. I tried to take pain medications at the time that would be able to relieve some of the pain, but that didn't help. And so in April, I contacted my doctor and told him what was happening. He requested that I come into the hospital and do some tests, which I did. I did a blood test, and when the results came out, he didn't find anything. He told me that everything was okay and that I should go for massages, physiotherapy, and acupuncture. And so I did. I went for massages and it helped a little bit, but the pain continued. I went for physiotherapy as well, but the pain still continued. The acupuncture, I did not go because I didn't like needles. But all of this just helped for the time being. The pain continued. I didn't still make much of it. I continued my work. I just assumed that because of what I do and I had to sit down for long hours, that was why I was feeling the pain that I had. Sometime in November, I fell down. It took my husband and my child to lift me off the ground and onto the bed. They insisted that they call 911, but I said no. I refused, mainly because I was just in too much pain to move. After a couple of days, when I felt like I was a bit better, I decided to go to the clinic around the house. I saw the doctor and he requested that I do an x-ray and some blood tests, which I did, and I went home. The following day, I got a call back from the clinic and they asked me to come in for the result of the x-ray. When I went in, the doctor said he wasn't sure of what he was seeing and that he would recommend that I go to the general hospital immediately, where they have bigger machines to do a more comprehensive test. And so I came out of the hospital, I went into my car, I prayed, and I called my husband. I told him what the doctor said and that we had to go to the hospital. He drove and we went straight to the hospital. We went to the emergency room. Unfortunately, we had to wait for long hours. But eventually, we saw a doctor. He requested that I do a CT scan for some reason and some more blood tests. I did that and I waited for the results. When it was time for the result, the doctor asked who I was with and I said I was with my husband. He said unfortunately he will not be able to tell me anything, but that he will recommend us to see a specialist. I tried to inquire why. He just said he's not able to confirm what he is seeing. And so we went back home. In a couple of weeks, we got a call from the hospital to come back. We went to the hospital. We saw the specialist. He also requested that I do an MRI. After that, he also said we should do some more blood tests. At this point, we were worried, concerned, and confused. Because even with the result of the MRI, he did not give us any confirmation of what was going on. He said we needed to do some more tests before he can give a diagnosis. But I was in so much pain And so the doctor recommended that I go for a radiotherapy to relieve me of some of the pain. I started radiotherapy for 3 weeks. And then he recommended that we go home and he will call me with the results. Not before he also recommended that we go for a biopsy. At this point, we were afraid of what the result would be. The biopsy involved a bone marrow test. Towards the end of December, we were both home and the doctor called. This time, he had a result and he had a diagnosis. He asked if my husband was there and I said yes. I put the phone on speaker. He said hello to my husband. And he said he was afraid that I had multiple myeloma, a type of cancer that is formed in the bone marrow, a blood cancer. I didn't know what to think. I didn't know if I should laugh or if I should cry. I was in shock. My husband held my hand and said everything was okay, that everything was going to be okay. I didn't want to believe it because at that point, we both did not know what we were up against. The doctor said that we had to start treatment almost immediately. By treatment, he meant chemotherapy. There was no choice. I knew I wanted to live. I didn't want to die. One of the difficult decisions we had to make was to tell our children of the news, but we couldn't tell them until we had all the results and all the questions, all the answers. We were trying to anticipate all the questions that they would ask, and we wanted to have all the answers before telling them, before changing their life. So we made the decision to hold on to this news. We went to see the doctor once again. He gave us all the information we needed, and we came back home. We eventually told our children. That was even more difficult than hearing the news. We all prayed together and hoped for the best. And so in December of 2023, we officially became a cancer family. I started chemotherapy in December. The doctor said I would have to have chemotherapy for the next 16 weeks. I was 46 when I was diagnosed. In January, I celebrated my 47th birthday while also going through chemotherapy. In the same January, I noticed that my feet had begun to swell up onto my calf. I didn't know what was happening. We had to call the hospital. After some tests, we were told that there has been a blood clot as a result of the medication I was taking for cancer, and that is also making my feet swell. I was diagnosed with thrombosis. I was battling swelling of the feet. I was asked to take some medication and also keep my feet up, that might help. The following month, I was also diagnosed with diabetes while still in chemotherapy. This was as a result of the medication I was taking as well. Diabetes came with its own complications. I was asked to stay away from certain food. I already had problem with lack of appetite, and I could only eat selected food. But I had to do what the doctor said. I had to do my best to stay alive. I had promised myself that I will take every medication, I will do every test, I will do everything that the doctor asked me to do, while I also prayed for God's intervention in my life. The day I completed the 16th week of chemotherapy was a day of joy because chemotherapy took a toll on me. The injection was in my stomach each week. It came with severe stomach pain, and my husband had to take me to the hospital a couple of times. The pain was so bad that I couldn't stand up still. So when I was told that this was the last injection, I was excited. I even had to ring the bell in the hospital just to give hope to other patients that their own day will come as well. But then came the next phase. The doctor informed us that I would have to go through a transplant, a stem cell transplant. Although it was explained, but it was nothing compared to the real thing. I went into the hospital and they explained to me that they would have to extract my white blood cells, freeze it, and give it back to me. That was the process. So in April, I prepared my mind for a stem cell transplant. I went into the hospital on the day off. They inserted 2 needles in both arms and told me that I would have to stay still for 8 hours. So blood was going out through one arm into the apheresis machine where they extract these stem cells, and then the blood was returned to my body through the second arm. It was a very emotional day for me. I felt helpless. I couldn't move. I cried. I could also see that my husband wanted to help, but there was nothing he could do at the time. Someone had to assist me with anything I wanted, even to drink water. It was a difficult day. At 4 p.m., the extraction was done, and I went back home. But I was told that in a couple of days, I had to come back to the hospital. They want to insert a PICC line. This is because I would have to do blood work every day. And instead of poking me with a needle, they preferred that they take the blood through the PICC line. Inserting the PICC line was another process. It wasn't a surgery, so to speak, but there was a time when I felt like it was. They applied some numbing cream, inserted something through my arm that went right up to my chest. It was a very difficult day because I had to carry the PICC line around for the next 30 days. The very next day, the blood work started. I went into the hospital. They extracted blood from the PICC line, and they also informed me that I needed to go and get myself admitted because I'll have to come into the hospital every day for the next 30 days. This was also because it will allow them to give me back the stem cell they extracted after a couple of weeks. So towards the end of April, the first thing they did was give me a high dose of chemotherapy. They said this will kill every remaining cancer cell, but it will also wipe out every immunity I have. And so 3 days after the chemotherapy, I was now to receive the stem cells that they had extracted. They considered that day my second birthday. Before going for the stem cell extraction, I had to take some injection myself, 10 injections. And I had to take 2 each day at home. This was a very difficult process for me because I don't like injections, and I had to inject myself. The doctor said that this would help stimulate the stem cells in my bone and in my body in preparation for extraction. And this stem cell was supposed to help me rebuild everything that the cancer was destroying. So after hearing all of this, I knew that I had no choice. On the day of the extraction, I was ready and willing because I wanted to survive. Post-transplant was another difficult phase. I was in and out of the hospital. There was a day I felt that I was having a heart attack and we had to go to the hospital. Luckily, it wasn't a heart attack. Although I was feeling chest pain, they did some ECG test and they confirmed that it wasn't. I was happy. We went back home, but a couple of days later, I was feeling so much fatigue. I felt like life itself was leaving me. We had to go back to the hospital, and I was on admission for about 4 to 5 days. There was a lot of tiredness with the transplant. I couldn't eat. I felt nauseous. But I had to keep going. We were going to the hospital every day, and each day was the same process. There was a lot of blood drawing. They would do some tests. We'll wait for the result of the test, and then they will let us know if it was okay to go back home. Towards the end of May, I began to experience hair loss, and within 2 weeks, I had lost all the hair on my head. This was new for me. I liked to cut my hair, but not to lose all the hair I had. The experience even went further. At some point, I sat down and I thought of it. Each month came with its own set of challenges. But as the months went by, I was getting better. I was getting stronger. I became a little bit more enthusiastic. The doctor said I was improving, that he thinks that the stem cell transplant is working. I was hopeful. I had an appointment with my specialist again, this time in a couple of months, in September. I was hoping for the good news. They did a comprehensive test, and I was waiting to hear him tell me that the cancer was in remission. But when we went to the hospital on the day of the appointment, that wasn't the news I got. The doctor said there is still some cancer cells left. I broke down and I cried. I wasn't listening to anything else that he was saying. Luckily, I had my husband with me, and he reassured me again that we will get through this. The next appointment, the doctor said that he wasn't worried, that in fact he was happy, that because the cancer is slow, that if and when it was going to return, it will be slow as well. And so this was good news. It wasn't in remission yet, but I was feeling a little bit better than I was a couple of months ago. Because of the transplant, I lost every immunity, including all the tests that I had done since I was born, which included the new COVID tests, COVID vaccinations as well. And so I went back to start the COVID vaccination. I went for the first one and then the second one. It was time for me to restart all the vaccines I had taken as a baby. This was sometime in October. I took the first set of 4 vaccines towards the end of October. The following morning, I woke up with a strange feeling. I went into the bathroom to brush my teeth, and I noticed a little bit of difference. It was a bit difficult to hold water in my mouth. I didn't know what was wrong, but I called my husband and I said, "Please look at me and tell me, what do you see? Is there a difference on my face?" And he said, "Yes, there's a little burn on a corner of my mouth." My eyes were watery. We had to go back to the hospital. I was told that this was Bell's palsy. It was sort of a facial paralysis, partial paralysis on the face. The doctor gave some medication, some steroid medication, and told me that my face will come back to normal, but it would take a couple of weeks or months. This was another challenge. It was difficult to eat. It was difficult to drink water. But that I could return to the hospital if it was getting worse. Luckily, it didn't get worse. Instead, as the weeks and months went by, it gradually improved, and it is still improving. The journey continues for me. Like I said at the beginning, this is my story of surviving cancer. The cancer is not in remission yet, but I'm still alive and I'm still fighting. When I first heard about the diagnosis, when the doctor first told us, the first thing I did was I went online. I went to Google straight ahead to find out how long do people with multiple myeloma live. And I saw 3 years and 5 years. I was very, very scared. When I went back to the hospital and I asked the doctor, he said, "In this case, Google is not my friend. That cancer is an individual disease. There is no cure at this moment, but there's treatment. And everyone's experience is different." The next thing I did was I went to YouTube to look for people that had the same disease, multiple myeloma. I found someone that was diagnosed, I think, almost 20 years ago. And I watched his video, I read his story. It encouraged us a little bit. If someone was diagnosed many years ago and he's still alive, it means there is hope for me, especially now that there are better treatments. I told myself then that one day I will tell my own story. Not just for people to know that this is what my family and I are struggling with, but also to create that awareness. I don't know how you can get tested. I don't know how you can check. But when you feel something in your body, don't ignore it. Don't just assume that this might just be something that will go away on its own. It's better to get checked and know that it is nothing than to ignore it. One of the things my doctor told me was that Although I was diagnosed by chance, I am very lucky. Otherwise, I wouldn't have known. I would have just carried on with my life until it got to stage 4. But I am one of the lucky few. I fell down, went to the hospital, and that's how I found out that I was diagnosed with cancer. Cancer is a very difficult disease to have, and it not only affects the patient, but it affects the entire family. Also, I want to say that I'm one of the lucky few that I have someone that is dedicated to be my caregiver, my husband. When I got diagnosed, I was still in shock for a long time. But when I came to it, I was able to tell a few members of my family outside of my immediate family and a few friends. They were my support. It's not a disease that you can ride alone. You need friends, you need family, you need people around you. Because it can be isolating. Because you are feeling what you're feeling. And sometimes you may not be able to describe it. There are days when I feel like I don't want to talk to anyone. There are days when I feel like I'm losing hope. There are days when I feel like, why me? I've been a good person. Why did this have to happen to me? But some other times, I'm also like, why not me? Who should it be? Like I said, I'm one of the lucky few. I tell myself sometimes that there are people that were diagnosed and they were told that they had a couple of weeks, months, or years. But this isn't my case. This isn't my story. My story and my journey continues. And I will try my best to continue to update videos as I can. If you have any questions, comments, please go ahead and ask. I'll try my best to answer them as sincerely as possible. I'm doing this more for awareness. I want people to know that it is not a shame to have cancer. It's nobody's fault. To date, there is no cure, but there is treatment. And as the weeks and months and years come, there will be better treatment as well. If you're out there and you're battling cancer, there is hope. Lean on to the people around you, if you have them, and count yourself lucky. As I have, as I am. Thank you for watching this video. If you would like to follow us on our journey and know more about cancer, multiple myeloma, please click the subscribe button so you will be notified when I post new videos. If you would also like to support us in various ways, kindly check out the links below. Thank you.